Harmony Place offers 5 different clinical tracks. Each of the tracks that we offer are unique in that they're all individually driven.
More and more in medicine, specialization is where you go. And there's a certain expertise necessary in each of the specialties. And so in order to treat eating disorder, in order to treat chemical dependency, in order to treat sexual addiction, each of those require a certain amount of expertise. The problem up to now has been that when you get expertise in one area, you don't necessarily have an expertise in the other area. And having been around now for 40 plus years, I'm not going to tell you how many, what happens is that most of the clients who get under control of one oftentimes develop a second. And so the missing link has been comorbidity, meaning that many of the clients have more than one out of control behavior. And as one goes down, another one comes up. And so the key aspect is to be able to have multi-specialties. So originally, I started by focusing on sexual problems. At Masters and Johnson Institute, where I started my work, that was my specialty. But a lot of the clients came in with trauma and trauma-related disorders, so then I had to develop a second specialty. And then as the years went on, more and more of the patients had eating disorder. So I had to develop a third subspecialty. And once I began to work with eating disorder for maybe 10 years and figured out how to treat that, then chemical dependency became the co-occurring disorder. So it seemed to me that if you didn't know about all of them, you didn't know about any of them. And so in the past, what people would do was they would refer out. So now that you've been under control of your eating disorder, let's send you to a chemical dependency unit. And now you've been to a chemical dependency unit, let me send you to a trauma program. And now that we've got a trauma program, how about bipolar? And it all seems sort of crazy to me. And so the idea was to have one program where we had a specialist in each of those subspecialties, and then the person could get multiple treatments at the same time. And so simultaneous treatment of these problems is far better than sequential treatment. And as that happened, our relapse rate went down remarkably. And so the idea of this is that it's hard for one clinician to be really good at everything. And so if you hire the best person around in each of those subspecialties and let them direct that track, and then have several people working with them, it's ideal. So we now have 5 tracks, and people come in and they're all together for a while, and then they break up into small groups under the subspecialty. The other important thing is to stay small. You know, in my previous incarnation, we had a large program with, I had 120 people on my staff. It just got too big, and you can't have the kind of treatment that's optimal when you get too big. So here we have 25 clients max, and the groups are sometimes there might be 3 or 4 people in a group, and you can really give them individualized treatment, and that's what it's all about.